Brilliant.
Yeah, if you can't tell, I'm in my car on the way, in the middle of Illinois. So.
You're not driving, are you? It's not. It's not.
Oh, I've been driving this whole time.
Is that a Tesla?
Yeah.
Awesome. Thanks, Claire.
That was amazing. Thank you.
So I think we're at our Q&A session, right?
That's right.
Yeah.
So if anyone has questions, feel free to either put them in the chat or, unmute yourselves and ask the questions.
Unmute.
Yeah. It's like, who's gonna be the first one? It's always it's also super important to note too that there is not one study that's showing breast implants are safe. Not one.
Well, it looks like we got one.
Okay. We have a question from Lauren. So she wants to know, do you talk with patients who want breast implants about the possibility of BII?
Very good question.
That is a very good question.
So back when I was putting breast implants in, which I no longer do because of my journey with breast implant illness, it was one of the main things that was discussed as part of the informed consent process with patients that were getting breast augmentation. So and now even recently there's new regulations as it relates to disclosing risks of breast implants, the so-called black box warning that is now associated with putting breast implant illness in. But the conversation with breast implant illness, I think, is no different than it would be with talking about other potential long-term risks associated with implants, such as rupture, capsular contracture, breast implant illness. So I would typically cover those three in detail with prospective patients so that they understand the potential long-term risks, because what's worse than potentially getting breast implant illness after a breast augmentation is just not even knowing that you have breast implant illness, because then you just go on to languish in symptoms for an undefined period of time and aren't able to get treated. So at least if it's discussed and disclosed to patients ahead of time and they understand the implications and the risks going into surgery and are willing to accept that in exchange for feeling better about themselves by getting the breast implants, then in the unlikely event, hopefully, that if they were to develop symptoms down the road, 6 months, 6 years, they at least know that it could be related and they can find somebody that can help them.
Yeah, it goes back to informed consent. That's exactly, so they don't have to suffer for 15 years. When they get symptoms, they're like, oh, I know what this is. They're not going from doctor to doctor and told they're crazy. So that's an important
And
point.
they can catch it early.
They catch it early. Mm-hmm.
Yeah, because what we see is it usually gets progressively worse. It seems like it's very exponential. So typically by the time patients come to see us, they're usually relatively severe. Sometimes it's found out early, but those are usually the patients that it's kind of put off until it gets to a point where it can't be ignored anymore and they really start getting desperate and looking for solutions. But what it seems like, based on our experiences, patients do well for a period of time, typically, not in Laura's case, but typically, and again, that might go back to genetic predisposition, but typically patients do well, or at least they compensate for maybe the breast implant illness for a period of time, and then the symptoms really start to develop and their condition deteriorates pretty quickly. I would say what I typically see is between like the 5 and 10 year mark. What do you think?
Yeah, that's about typical, but again, no, that's about right. 8 years. Yeah, that's about right. But again, there's no really significant rhyme or reason with that either. But by the time they get to us, they are very ill. They're not like, I have one symptom, I want them out. They're
I mean, we don't even do surgery on patients with one symptom. I mean,
No.
it would be a very difficult discussion to do that. Most patients, like you can see here, and this is all just experience now, but
symptom sheets over and over.
We get symptom sheets now for patients after surgery, so we can compare, their resolution of symptoms more objectively. But hundreds and hundreds of patients, and usually the symptom sheet is completely filled out. It's like 80% with boxes checked.
Yeah, I
So-
just had one come in yesterday. She was at her 6-month mark, which actually does help. It does happen earlier, and she looked at that sheet, and there was not one thing that she could X off, and she had X'd all 50 off.
Diana has a question also. Thank you, Lauren, for that question, by the way. Is there any research, it's a two-part question, is there any research into alternative materials for implants or any hopes for the future for those who would still like breast implants and avoid BII?
So what we see a lot of now in our patients, and I think kind of probably the trend in a lot of plastic surgery practices in implant conscious patients is the move to using autologous tissue, and that's been done for a long time in breast reconstruction and in other areas of cosmetic surgery. You've heard of the Brazilian butt lift, I'm sure, so that's basically harvesting fat, patient's own fat, and transferring it to another anatomic area, in this particular case, the buttock area for obvious reasons, for enhancement of appearance. And that's a graft, it's a fat graft, just like if you were to take a skin graft or a bone graft, it lives in the area where it's being placed, so it's harvested like any other liposuction type of procedure, and then it's used to augment the shape and the size of the recipient site, and in this case that could be the breast following explant surgery. So we do see a lot of patients that are using fat grafting either in conjunction with the explant surgery to enhance the outcomes with expectations set, understanding some limitations of it in that context, and then patients coming in for primary breast enhancement that don't want implants for whatever reason, that are able to get great outcomes using their own tissue with an autologous fat transfer to the breast. And I'm not aware of any, types of implants that are coming out that are, potentially safer.
Thanks, Diana, for that question. Karina has a question as well. I think you might want to clarify this question with her. So she says, you mentioned that some patients with BII do not have symptom improvement after implant removal. What would be the next step for treatment in this scenario?
That's pretty unusual, really unusual. I mean, out of hundreds of patients that we've treated now, I don't know if I could think of even one that hasn't had any resolution of symptoms.
Not one.
I think she might be referring to when they had the implants out but not the capsule.
Oh, okay. So what was the question?
What would be the next step for treatment in that scenario that they don't have symptom improvement?
Detox.
So maybe what she's asking is, and sometimes patients will get implants out and they don't see improvement in their symptoms, and so next step would be, like we showed in the video, to go back and make sure that it was done appropriately and do the complete capsulectomy. We also plug our patients in typically with functional medicine doctors that can do some additional medical detox and see if they can find any additional reasons for symptoms that did not resolve with the explant surgery, and that also seems to be helpful.
Great, I hope that answered your question. Let me know if needs further. She says thank you. Any other questions, you guys? Is there anything else that we didn't touch on that you guys would like to make note of?
No, I would just let the patients know, let the students know that if they are interested in learning more about breast implant illness, they're welcome to come here and meet with Laura and/or I and talk about it. There's always new and evolving studies that we're interested in doing, so we would welcome anybody that's interested. And obviously, if there's any rising plastic surgeons in the audience, we encourage you to learn more about it and come talk to me. Be happy to give you some guidance. Anybody can just email me directly, lpryor@drpryor.com.
Yeah, we also do have, having 45 med students, somebody's going to know somebody that has breast implants, may have, been having some symptoms. We also have a support group. It's Dr. Pryor Dr. Landon Pryor, BII Explant Support Group. So if anybody has somebody and it's like, hey, this is a very personal, not everybody goes out and says, oh yeah, I have breast implants. So you're more than welcome to join that also. You just have to answer a couple questions. I'm the admin. My name is Laura Dawn. And you can also reach out to me at laurabowden@drpryor.com. I'd be happy to help you any way I can. Even looking at studies, there's studies that literally have been just like shoved underneath. So there's some pretty concrete studies coming out, and there's studies that have been around. We just don't see them. They're just being stifled. So if you want to research a little further, Dr. Pryor and I could help you do that.
Appreciate everybody's attention and time. If we don't have any other questions, we'll conclude today's session, and let me know if I can be of any further help to anybody on the call.
Yeah, and continue.
Recording stopped.
Oh man, that's okay.
Thank
That's
you,
good.
Gretchen.
You are most welcome. I did put in the chat Dr. Pryor and Laura's email addresses if anybody wants to copy those down. You can also reach out to me directly and I can provide you their contact information if you are interested in Dr. Pryor's rotation
What's that?
or contacting
Thank you.
him with any questions you might have.
That's awesome. Thank you.
Anyway, thank you so
Yes,
much.
Thank you all so much.
All right, have a good
Bye.
weekend.
Give me a thumbs up.